With branches throughout Africa providing pathology and health-related consultative services, Lancet Laboratory is currently under investigation for potential fraud regarding COVID-related funds. Since the start of the coronavirus pandemic, thousands of COVID-19 tests have been conducted by labs across the country. And while they arguably stand to rake in millions as a result of increased testing, what is the cost to employees who work long hours in a highly pressurized environment to deliver the much-awaited results by desperate citizens eager to learn about their state of health?
We feel unthreatened and unsafe there at work. We're only going to work because we've got nowhere to go. The pandemic itself, it's a stress to us. We have never been told never even been trained about this thing that we're working with, this COVID. It's stressful.
Remember even the community that they are coming into the Lancet to do the test. We are testing them, and as we don't know ourselves whether we are positive or negative.
Some employees at Lancet labs across the country, including technicians, nurses and administration workers, accuse the company of widespread labor and human rights abuses, exacerbated by the advent of COVID-19 in an environment where they say they cannot speak out. Despite working in environments that should excel in health standards, health services workers around the country on the front line of COVID-19 have raised concerns about their working conditions. Testing laboratories are at a particularly high risk of viral contamination because they are constantly dealing with COVID-19 positive samples. Fearing victimization, this employee chose to remain anonymous. He is among those who accuse Lancet of negligence through exposing them to the virus. Employees also accuse the company of disregarding their labor rights and shortchanging them of their benefits. Among other things, they say that some employees' salaries for the month of May were unilaterally cut by 30% without consultation.
There was a letter written to us that they are running off a loss. And we don't know of which loss they were running. During level 5, that's when we started to be told that they're going to cut our salaries by 30% and what. The working environment at Lancet is very bad, as employees are ill-treated by management and HR. And HR is taking Lancet's side. Instead of standing with the employees like HR must do, it stands with management. That's the problem we are faced with. You try to ask some of the things, all the essential service, all the companies that are doing essential service got paid the money of the relief fund. We haven't got our salaries. Our salaries on May were cut by 30%. As essential service, we didn't get our risk allowances still to date.
We approached the UIF to ask whether Lancet has received any COVID-related funds from the state.
Lancet has indeed applied with UIF. I can give you exact figures to date. For April, they applied for 61 people. We were able to pay 285,000 to Lancet. In May, they applied for 49 people. We paid them 236,000. And then we have a scheduled payment for them. For 4,275 people, we will be paying them 20 million rands, 20.8 million rands in the next few days. It could go out today or between today, tomorrow, and Saturday. This payment could go through to them.
This means that for April and May together, Lancet has been paid 521,000 rands in total. And at the time of this broadcast, it's expected to have received an additional 20 million rands. But the employees that we spoke to say that they are not aware of any relief payments in their respective departments.
We feel unthreatened and unsafe there at work. We're only going to work because we've got nowhere to go. The pandemic itself, it's a stress to us. We have never been told never even been trained about this thing that we're working with, this COVID. It's stressful. You ask about such things, you start to become a victimized. You are being victimized. And some of the things, they'll start even to change and amend new rules because they took all of us, all of our money. They took, we working Saturdays for free, Sundays we don't pay anything. We will be told that you owe the company 10 hours. We just don't understand what's going on with Lancet. All the things that they do, they are wrong. They are just unlawful. They don't go accordingly the Labor Act and relations.
Yeah.
So, why would this employee not have been paid?
When we test our records against this ID, what we're picking up is that for April, they didn't apply for this individual. It appears that they've applied for the person for May, and the indication is that they paid this person 8,000 rands, and the salary of this person per month is 9,000. So our calculation is likely to give this person around 1,004.
The company has also been flagged for suspected fraud in relief funds applications.
Lancet applied for 3 deceased people. In fact, if I were to break it down, they applied for 12 people with active UIF claims, which means these 12 people may be fired, may be on maternity leave, but any of the different benefits that they are already receiving from UIF. Then there's also 3 people that Lancet applied for that have died. And for us, if we compare against Home Affairs, and Home Affairs says these people are reported as dead in our records. There is an investigation underway because for every deceased person who's applied for by a company, we take it to forensic investigation because they need to ascertain if it's a fraud case or the company just pulled their data and plugged it onto the database and apply, which is also possible. But we flag it and we alert the company that your case is under investigation due to the deceased case that we've picked up. And then we only lifted up the flag on the company once the company confirms the status of the 3 people.
Have they confirmed with you?
Not yet.
They haven't yet.
They have not yet confirmed.
Some Lancet staff accused their employer of neglecting their well-being by failing to provide them with the COVID-19 tests despite their high-risk working environment.
They tell us if we want to go and test, we must pay for the test. The Lancet that is not going to pay anything. We are a medical lab. We ask ourselves, why can't they just test the rest of us and see where we're standing?
In addition, employees allege that they are made to repeatedly wear the same PPE, masks, and suits, despite the World Health Organization guidelines that discourage their reuse without appropriate decontamination or sterilization. Through these pictures, they claim that they have to reuse PPEs for about 5 days. They allege that the company still uses biometric systems with no sanitizers in sight, and sample-preserving plastic bags are apparently being reused for days.
People will be given a working suit. That working suit you must use for almost 5 working days, and that thing is a once-off thing. So where does our check fit in there? She fails us. She fails us because Labang, I'm a sister, they'll go to draw blood, they'll go to do a swap with that thing and come back with those things again. They're infecting us. We are the ones who are working hand in glove with the sisters. Once a sister is done with the blood, we are the one, the couriers who must run to and take those blood and make sure we feed those bloods to the corrective department. For Christ's sake, I'm a work suit are being washed. How possible in Lancet? How do they wash? But wash a man because they're using jig and they tell you jig it's gonna disinfect the work suit.
Some literature says bleach can be used depending on proper training, material type, and following a strict process.
PPE is still a problem. Where others they wash the coat, the lab coat, disposable coat, they wash them. For you to change it, it's when it's torn, when maybe it's too dirty. It's when you can change that lab coat. You can take maybe 2 weeks using one lab coat. Or maybe we can even share it as the staff members. If you're off, they give somebody your lab coat to wear it. Remember, it's infection again. We cross infection, but it's what they are doing. Every time when we ask for their lab coat, they will tell you that it's back order. Everything is back order apparently at Lancet regarding PPE. It's back order. Mask N95. They will tell you that no, this one you can use it for about a week. How can you use mask for a week? Really? But at Lancet is what we're doing. You wear your mask for a week. You put it safe. Next day when you come, you wear it again. Every day you use same thing. And the other thing, sanitizers. Other sites, they lock them. You need to cry for sanitizer. At the doors where we enter to go into the lab, there's no even sanitizer. And remember, it's press buttons. It's where we're getting COVID from first time. We get COVID before we go into the lab. Because we need to go to the door and press button, the PIN number, so you can enter the lab.
Despite these very serious allegations, the South African Medical Association says its investigation has not shown any wrongdoing on the side of Lancet.
SAMA looked at the facts and also contacted Lancet themselves. And so far, we cannot see any unsafe or unsanitary conditions. The protocols that they are following is in line with the World Health Organization, as well as the Medical Advisory Committee of South Africa, guidelines and recommendations. What Lancet did is they categorized their workers into three different categories. One is the staff that is doing the physical work, especially regarding the taking of tests. And they are being supplied with the appropriate PPE, meaning the correct mask, the apron, as well as the gloves that they are supposed to wear. On personnel that is not doing any of those aerosol procedures, it is correct that you then only use your three-play facial mask. And then for personnel who doesn't work with patients but are more in the courier and not an administrative areas, again, there you can use your PPEs if you want to, but it's not compulsory. And as long as they do the social distancing, that is supposed to be compulsory in each and every working place. And unfortunately, we cannot come in and make patients do that. We have seen it more than once, that patients or workers, employees, doesn't listen and do not adhere to the guidelines. But that's got nothing to do with your employer then. It is your choice if you do not want to wear the correct infection prevention procedures and PPE. So again, also there's a allegation that the cars are not clean enough. Unfortunately, there is no special treatment, and ordinary water and soap will destroy the virus.
This Lancet employee says she is not aware if she has contracted the virus and whether she could be putting patients at risk.
And as we don't know ourselves whether we are positive or negative, really we don't know. Maybe we're positive, we're sharing that bag, we're giving them that bag while they don't have it. But after that, the results will come back positive due to us because we don't know ourselves. Where are we with this virus? Because apparently since I've tested in March, now it's what? It's July. And I'm working at that site, I'm doing COVID. I am doing COVID. Do you think I won't get it? Maybe I have it. It's just I don't know. And maybe remember our company, they don't even care about us. You need to get sick so you can go to your doctor. Doctor must refer you. And you must do the swab. Remember, you need to pay Lancet now.
57-year-old Sizakele Mkhize has worked for the Auckland Park office of Lancet Laboratories for 14 years. She works at the collections department and insists on identifying herself. Mkhize says although a number of her colleagues have tested positive for COVID-19, protocol around quarantine and isolation of infected or exposed staff has also been flouted.
Ngihamba ngitesta clinic because abafuni ukusitesta vele. Ngihamba ngayi clinic sis. Bakubuza kuqala ukuthi unama symptoms na if unama symptoms abakutest. Noma sebekhona abantu abagulayo abakutest. Bebephuma abantu bahamba quarantine phela sifike sithathe case 7. Okwesibili lapha emsebenzini si share igate li1 sipressa imina sonke egatini sonke. Siphuma egatini eli1 ngemina sonke. Mas clock ekseni siclock in or out ngecomputer A1. I'm 57 years. So ngacabanga no eating hambe ngiyotest. Ngahamba ngotesta kwenye iclinic la eRostenville. Mangitesta it was Thursday, I think we second. Right? Mangifika lapha bengaguli isifuba sami sivaleka. Afika ngicheck sister athena no. Ngoba isifuba sakho sivaleka. It is what sasesikwenza test.
She says the nurse at the public clinic recommended she takes a few days off while awaiting her results and only return to work the following Monday.
Ngabanikezela iletter engibuye nayo eclinic. Ngasebenza Monday, Tuesday, Wednesday, Thursday. Friday, I think ngaboma 12. Ngisa driver ngiyasebenza la ngilanda umsebenzi ngenzani yonke lento ngendlela isebenza ngakhona. Ngithole i-message kwi-phone yami ngoba beshithe i-message izongena kwi-phone. I-message mayingena kwi-phone. I-message ithi I'm positive. Ngivana ngibuye. Bengiya kwenye ilokhuzana i-lab esePark Lane. Ngivana ngijinga ithi ngivana ngijike ngibuyele emuva e-Auckland Park. Nangempela mangifika e-Auckland Park ngingena. Mangingena ngiye kwi-transport department ngoba ngiya-drive. Ngifike lapho ngitshela u-transport manager wayikhona ukuthi sekunenkinga enje ngenze njani athena no ungasasingene sisikhiye ngaphakathi la kuthini thatha imoto ise-Washing Bay ngathatha imoto ngayise-Washing Bay ngabhala ama-kilometers ngaqeda ngihlangahlangene ngithola lento esikhathini esinzima at my age u-12 emsebenzini angazi kufanele ngenze njani i-trauma kimi from there ngihambe ngiye ku-supervise angifika ku-supervise ngimchazele ukuthi as is a lady senginesebenzi nje yena vele uyazi ukuthi ngitestile. Okay fine athena yazini akuhlale phansi bese ngitshela ukuthi obani abantu mhlawumbe owaxhumana nabo nani emsebenzini ngimtshela bengisebenzela lana athena nje ngokuorganize i-transport now aphume ayo-organize i-transport.
She says while she was waiting for a supervisor to return with a car to take her home, a call came in.
Kungena i-call ukuthi angiphume ngapha. Angitshela lo-supervisor ukuthi nansi i-call ingena. Ubani ngiyamazi igama ngeke ngikwazi ukumention. Uthi phuma uhambe. Because asafune bona la. Ngisathi ngibekezelele lokho. Angeke abu-supervisor nobekade ngi-organize i-transport. Athi kimi bayala ne-transport but awusenalo ilungelo lokuthi wena ungahamba ngemoto eselancet. I-trauma engiyo. Ikhampani izongikhipha kabuhlungu kanje ngoba ngiyi-positive. Ngiyi-positive ngiyithathe mina lento. Ngimdala nje kokuqala why ikhampani ingami nami kulesi simo ngisanti okay relax until mhlawumbe uphuze noma amanzi bese hamba ungaxasha kabuhlungu ngikhisha kabuhlungu lapha ngoba ngiyi-positive. Mangiyi-positive akusashida ngithathe kwale moto at least bengiyisebenzisa esingcolile njengami.
Distraught as she was, Mkhize says she had to find her own way home.
Mangiphuma laphana bengazazi igama lami ngisibuza ukuthi kufanele ngithathe i-taxi or kufanele ngenze njani ngiyofakela abantu ebhasini and ngiyofakela abantu elokhuzeni eteksini. Bengenachoice ngigibela iteksi. Kubuhlungu kimi ngikhala sise eteksini abantu bengazi ukuthi ngikhalelani. Ngikhalisa ukuthi manje njengoba ngingena la bangaka abantu engizobathelela.
Mkhize says she's traumatized that she may have infected others while traveling in public transport to her home.
It's not easy ukuthi inqobeke makunjalo ngoba uma ngabe mina ngizophuma emsebenzini ngixoxe ukuhamba wena sakudingi la ejardini lethu ngiyogibela eteksini abantu bayi-15 eteksini already laa nto awu-15 mhlawumbe sabe-affected ngenxa yami Mangisuka lapho ngigibela itaxi yokuqala ngaphinda ngagibela itaxi yesibili ngigibela kayi-2 ngigibela ngisho edrobheni. Mangifika edrobheni kufanele ngigibela itaxi ezolala la ngihlala khona. Bangaka abantu imphefumulo ewu-30, 15. Mangisuka e-Auckland Park ngisedrobheni ngiphinde ngigibela itaxi edrobheni yabantu abawu-15. Uma ngabe ngigibela ibhasi abantu bawu-70 ebhasini noma ba-more 70. Labo bantu namhlanje banjani? Hayi ngisho ukuthi bakule simo engikusona.
Lancet initially declined to comment, but later sent the following written responses to the various allegations. The company says it follows all protocols relating to COVID-19 infection control. Regarding PPEs, it says despite occasional shortages, they have generally been able to source stock, but call for employees to approach management with concerns whenever they arise. They deny that their workplace is unsafe and insist that they respond accordingly whenever there are potential infections. Lancet blames a decline in turnover for the staff pay cut. Despite the UIF saying that they have paid employee funds directly to Lancet for distribution to employees, Lancet claims that it has elected for funds to be paid directly to employees and blames the UIF's technical problems for staff payment delays. But the UIF questions these claims and maintains that over 500,000 rands has already been paid directly into Lancet's account, with about 20 million rands more expected to have been paid by the time of this broadcast. According to its website, Lancet Laboratories has 4,000 employees across all of its locations on the continent and generates nearly $81 million in sales. Since the beginning of the COVID-19 pandemic, the company has attracted negative news from as far as Kenya. In Zimbabwe, workers shut down operations due to alleged unfavorable working conditions. Labor union NEHAWU says it's investigating all South African lab companies following similar complaints across the sector.
I-trauma isimene bengikusona bekufanele icompany ime nami angisho ukuthi khona akufanele bakwenze kodwa hayi ukuthi ngikhishwa kabuhlungu manje bala ngisho nanemoto zabo ngabe banginikele imoto ebisingcolile phela efana nami ukuthi ngihambe ngeenyawo ngokuqala ukuza ama-results ukuthi positive it's not easy i-COVID-19 iyabulala angisho ukuthi ngizawufa no kodwa kufanele bangixoshe ngale ndlela abangixoshe ngayo. I
just want to say to them, please guys, look after us as staff members. Just give us a day where you can just close and test the staff members and see how many positive are they so they can quarantine at home. Those that are negative, they can continue working nicely while we know that, okay, now we are negative only. And they must do this maybe twice a month or once a month. It doesn't mean maybe they're losing. Because we're making money, we are the people that are making money. Remember the managers that don't do COVID, they are in the offices the whole day. Drivers, nurses, admins, techs, they're the one that they are on this COVID floor.
Lancet, the only thing they care about is revenue. Employee at Lancet is nothing. Because one of our pathologists told us an employee can just get an employee by the gate. We are illiterate, we are circus department. That's what we are being called that way. Lancet's management is very poor, it's very poor. I even ask myself, because we are working with doctors, we're working with doctors. I even ask myself, do these doctors have qualified doctorate or did they buy their doctorate? I fail to understand because they are the ones who are supposed to be protecting us and helping us. In terms, they just don't comply with labor laws. They don't comply with safety. They don't comply with anything. We are just at risk. We are just at risk.